Good morning, everyone. We'll start today's media briefing with Mayor John Cooper and Dr. Alex Jahangir, Chair of Nashville's Coronavirus Task Force and Chair of the Metropolitan Board of Health. Also here we'll have Deputy Mayor Brenda Haywood and State Representative Harold Love Jr., as well as Dr. Joanna Shaw-Kaikai. Joanna Shaw-Kaikai is our Associate Medical Director and Communicable Disease Control and Infectious Disease Specialist at the Metro Public Health Department. Here today to help answer your questions will be Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department, and Dr. Gil Wright, Interim Medical Officer for the Metro Public Health Department. We'll now begin with Mayor John Cooper.
Good morning, Nashville. Today, I want to start by announcing a citywide campaign to increase immunization rates in our communities of color. This important initiative will reduce barriers to choosing and getting the vaccine, and the barriers that many of our neighbors are facing. And now these barriers include transportation, language, the digital divide, and access to accurate, up-to-date vaccine information. And I want to welcome Deputy Mayor Brenda Haywood, State Representative Harold Love Jr., and Dr. Joanna Shaw-Kaikai, of Metro Public Health. And they are leading this effort and have joined us this morning. Now, this campaign will include virtual town halls, on-site immunization drives, and other safe public events to get more people of color vaccinated. The vaccination rate among Black Nashvillians is more than doubled since our vaccine rollout began. And for our Hispanic community, the rate has grown by 10 times. But immunization among residents hit hardest by the pandemic is growing, but it has to continue trending up. Now, we will work with faith and community leaders across Nashville to get the word out directly to all our neighbors. And I'm grateful to everyone who is part of this important immunization campaign. Now, Dr. James Hildreth, President and CEO of Meharry College, is unable to join us due to a prior engagement, but I want to recognize Dr. Hildreth and Bobby Watts, CEO of the National Healthcare for the Homeless Council, on their appointments to President Biden's COVID-19 Health Equity Task Force. Now, 2 out of the 12 task force members are from the Nashville area, and we're grateful for the work they do on behalf of our community and the entire nation. Now, let's review the latest developments on our phased vaccination strategy. Almost right at 125,000 total first and second doses have been administered in Nashville by all healthcare providers, and that's up from 104,695 last week. Nashville is nearly finished offering vaccinations to all 75,000 Phase 1A recipients, which includes our frontline healthcare workers and first responders. And 51% of our seniors, 75 and older, have started their vaccinations, up from 41% last week. And there are 38,000 residents in this group of 75 and older. Now, I announced on Monday Phase 1B teachers and child care workers can begin scheduling their vaccinations today. Nashvillians 70 and older will be starting scheduling their vaccination appointments tomorrow, and combined there are 48,000 teachers and residents 70 and older in this next wave of vaccinations. Now, very importantly, to schedule your appointment, if you're 70 and older, visit covid19.nashville.gov or call 615-862-7777. Now, Vanderbilt will vaccinate teachers at our public and charter schools. HCA TriStar is giving doses to teachers at private and parochial schools, as well as preschools and daycares. With our hospital partners' help, we expect to administer 7,000 doses a week to Phase 1B workers and residents. Now, efficiency and courtesy have set Nashville's vaccination process apart from other cities, and we're grateful to public health and our hospital partners for making that successful. We will continue to deliver the same experience to Phase 1B teachers and seniors 70 and older. Now, here's an update on our latest COVID metrics. Nashville's total case count is still trending down, with 2,897 total active cases as of this morning. That is the lowest since November the 11th. This is a 12% improvement over the past 7 days. Our 7-day average of new cases per 100,000 residents is 34.7. That's a decline of 20% week to week. And Nashville's 7-day positivity rate is 6.0%, down from 8.2% last week. And there was an all-time high in that metric of 21% back on January the 4th. Our transmission rate remains below our target of 1, and it is at 0.87. But that has increased a little bit from 0.82 last week. As of today, Public Health is reporting a total of 611 COVID-related deaths in Davidson County. Every death in this pandemic is a tragic loss for our community. But the vaccine, and most important, our healthy habits are saving lives. Nashville's case fatality rate is at 0.7%, and that's lower than the state's rate. The state's fatality rate of 1.43% is a little bit more than twice as high as Nashville's. And our state's rate is closer to the U.S. national average of 1.72%. Nashville, your efforts here are making a difference. Keep wearing masks, social distancing, and avoiding crowds to protect yourself. And let's keep our schools and local businesses open and help Nashville return to normal. And with the help of our healthcare partners, Metro has administered 963,000 COVID tests across Davidson County. It's possible that Nashville will perform its 1 millionth test before our next press briefing, a remarkable milestone reached in less than a year. Remember, COVID is still in our communities. 2 of the 4 new variants of the coronavirus have been found in Tennessee, which makes testing more important than ever. Dr. Jahangir will discuss these variants in more detail and what they mean for Nashvillians. If you feel symptomatic or think that you've been exposed, do not hesitate to get a free COVID test at one of Metro's community assessment centers. And today, I'm pleased to introduce this week's community heroes. And that's the Nashville's Wego bus operators. For many Nashvillians, Wego buses are their only means of transportation. Our buses help connect many of our essential frontline workers between home, work, and other daily responsibilities. Since the start of the pandemic over 11 months ago, our bus operations and other Wego personnel have safely transported Nashvillians through careful planning and public health protocols. I'm grateful to them for the work they do to keep Nashvillians moving during this challenging time. And now I'll turn it over to Dr. Jahangir, Chair of the Metro Coronavirus Task Force. Thank you.
Good morning, Nashville. Here's some additional information on the COVID-19 in our city. Total number of cases now is at 87,282. A rolling 14-day average of new cases is about 265 each day, and that's a drop of 81 cases since last week, and the lowest it has been since November. We have tested nearly 965,000 individuals, and over 400,000 of these tests have occurred in our community assessment centers. Number of individuals hospitalized in hospitals are also greatly improved. Middle Tennessee hospitals now have 389 individuals, down from 450 just last week. And Davidson County hospitals have 242 individuals hospitalized, down from 280. Now, as we continue to monitor these other strains of the virus, I wanted to report the following. There have been no new cases of the new variants since our last update. Last week, we reported that 2 cases of the UK variant had been seen here in Nashville, and there have been no connection between these 2 cases. As you may have heard, there's also variants from South Africa and Brazil that are starting to make their way into the United States, but none of these have been found in Nashville thus far. The vaccines have been shown to be a little less effective in the UK version, but there's some worry about their effectiveness against the South African and the Brazilian variants. This is why it is so critical to continue wearing masks, and why just yesterday the CDC updated on their recommendations on wearing masks to prevent the spread to these new variants. Now, regarding vaccines, so far 63,400 Nashville residents have received their first dose. That's 10,000 more Nashvillians were vaccinated today than there were this time last week. And of these people, more than 31,000 have received their second dose. As the mayor noted, 51% of our seniors over the age of 75 have been vaccinated. 43% of whites who are over 75 have been vaccinated. 29% of blacks over 75 have been vaccinated. And 35% of those of Hispanic ethnicity in Nashville who are over 75 have been vaccinated. This weekend, we plan to move into the next phase of our vaccine rollout. Residents over 70 and above will begin getting their vaccines at the Music City Center. You can sign up tomorrow on Friday at our website, covid19.nashville.gov, or by calling our number 615-862-7777. And beginning the following weekend, we'll begin to vaccinate our teachers and staff of our K-12 schools, as well as our daycares and preschools. Now, this morning, I also want to answer some common questions that we've received about the vaccine. First question is, if you're pregnant, should you get the shot? And yes, it does appear that the vaccine is safe in individuals who are pregnant, so you should get the shot when it's your turn. And in fact, just yesterday, Dr. Fauci noted that there have been over 20,000 individuals who are pregnant in the United States who have received the vaccine, and to date, there has not been any red flags. Now, if you have COVID, should you still get the shot? The answer here again is yes. Now, COVID-19 has very severe health risk when you are infected, and there is a possibility of reinfection. So it's recommended that if you have COVID-19 and you've recovered, wait about 90 days and then go through the vaccination protocols, assuming you're in phase. This will give chance for your body to, again, re-up its immune response and give you the protection that the vaccines can afford. And can you still spread COVID-19 if you are fully vaccinated? Now, this answer is not as simple. Most infectious disease experts believe that the highly effective vaccines that we have out currently will lower the risk of spreading the disease. However, there is still yet not enough information to determine if the current vaccines offer what is called sterilizing immunity, meaning those who are vaccinated can no longer spread the disease to others. So again, this is why it's so important that people who are fully vaccinated, like myself and a lot of other healthcare workers, to still wear the mask, especially around those who are not vaccinated. Now, a couple of notes. Today and tomorrow, our community assessment centers will be on our cold weather plan. This means that only our Nissan Stadium location is open from 10 a.m. to 3 p.m. And the centers in Antioch and Meharry Medical College will be closed to protect our healthcare workers who are providing these tests. And on Monday, both the Community Assessment Center as well as our vaccine site at the Music City Center will be closed due to the federal holiday. Now, the numbers continue to be encouraging. 5 of our metrics are green. 1 is yellow and 2 are red. Please continue to do what all of you know what to do, because this is what's allowed us to have this success. Stay apart, keep your mask on when in public, and keep your distance. If you're worried about if you've already been exposed, get the test. And if you do get a test and it's positive, don't forget about monoclonal antibody treatment. This literally may save your life. And of course, when it's your turn, get your shot. This is the best way to end this pandemic. And now I'd like to turn it over to Deputy Mayor Haywood. Thank you.
Good morning, and thank you for this opportunity, Mayor Cooper. I would like to start by thanking you for your zeal, your commitment, and your support of this initiative. Communities of Color COVID-19 Vaccination Initiative 2021 campaign. This is an initiative among Representative Love and Dr. Kai of the Health Department and the mayor's office, and we're very excited about what's coming down the pike. I also want to thank Mayor Cooper for his overview of what we have planned, because it was on point and extremely adequate and empowering for us. I want you to know that our mission is to educate, to empower and build trust among people of color in our communities as it relates to the efficacy of the COVID-19 vaccination. I want you to know, as we struggle to close the racial and ethnic divide and the gap in the vaccination rates among people of color, our partnerships seek to encourage, educate, and to empower. We are providing comfort, confidence, and access regarding the COVID-19 vaccination in communities of color. We invite you to join us, partner with us as we try to change the trajectory of this city in terms of, again, the lagging in terms of the rate of people of color being vaccinated. We want you to know something that you already know. Injustice anywhere is a threat to justice everywhere. Join us as we partner to get everyone in our city vaccinated in 2021. Thank you for your time, and we look forward to you contacting us and joining us in this important effort. Thank you, Mayor Cooper. At this time, I would like to call Representative Harold Love, which is representing the faith leaders in our community, to the podium.
Thank you, Deputy Mayor Haywood. Good morning. I want to thank Mayor Cooper for this initiative to promote access to the vaccines for communities of color. We have to be intentional in our efforts to make sure that our most vulnerable populations are protected, and this effort will reduce the spread of COVID-19. During crises, we know that people turn to the faith-based communities for hope and for help. In 2010 flood, we saw this happen. In 2020 tornadoes, we saw this. And also we see it in our current efforts to reduce the spread of COVID-19. I believe in the vaccine, and I'm looking forward to getting vaccinated myself. And I encourage you to follow us as we lead this initiative to make sure that all communities are indeed vaccinated and we reduce the spread of COVID-19. Now I want to introduce Dr. Shaw Kai for remarks.
Thank you, Representative Love. Thank you, Mayor Cooper and Dr. Jahangir, for this invitation to speak today. Thank you, Nashvillians, for the opportunity to speak to you. Our dedicated and hardworking Metro Health Department staff and partners are working daily, administering vaccines, and we know that we still have work to do to reach certain communities of color and disadvantaged communities. That work includes building trust and clearing up myths and misinformation about the vaccines. A myth that is currently circulating is that there is a better vaccine given to whites and a less effective vaccine given to blacks. That is not true. Everyone receives the same vaccine regardless of race, color, or ethnicity. Also, the vaccines are safe, and a person cannot get COVID-19 disease from the vaccines that are administered. In Nashville, about 18.4% of COVID-19 disease occurs in blacks, but blacks experience about 31% of the deaths that have occurred in Nashville. Recently, I was reading an article that stated that about 30% of minority households do not have access to internet or stable internet. The Metro Health Department and the mayor's office are rolling out a plan, as you heard the mayor and others refer to, that includes efforts to educate the community at the grassroots level to make sure we are reaching people via various modalities. Also, the plan includes mobile teams going into the communities to vaccinate, especially when we get into phase 1C. And phase 1C consists of people with underlying health conditions such as obesity, diabetes, and heart disease. The plan will be adjusted as needed. This will be a citywide effort. The great Martin Luther King said, "Everybody can be great because anybody can serve." You can serve by signing up and getting the vaccine when you are eligible to, and also telling others about the vaccine, or even assisting a neighbor or a family member to sign up for the vaccine. Remember, the COVID-19 vaccines that are currently available are safe and effective at saving lives. Thank you.
Thank you, Dr. Shaw Kai. That concludes all of our comments today. We have no questions from media. So I would like to thank Deputy Mayor Haywood, Representative Love, and Dr. Shaw Kai for joining us today. The next COVID press briefing will air on Thursday, February 18th at 9:30. Thank you for joining us, and that concludes today's briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.net.